Hi, my name is Chloe. How are you doing today? You'll be having Mohs surgery today, where the doctor is going to be removing some thin layers of epidermis on your cheek to inspect for signs of skin cancer, and the procedure is going to be repeated on that side of your face until there's no signs of cancer. The overall goal of this surgery is to remove all the skin cancer without hurting any of the healthy skin around it. And the type of cancer that's being removed from your cheek is basal cell carcinoma, which it can sometimes look like an abrasion or a contusion, and depending on what type of discoloration it has and what stage this cancer's at. And basal cells are basically just regenerating skin cells and sometimes can be overexposed to UV rays, like sunburns or just not wearing sunscreen or anything like that when out in the sun, and they can become cancerous, and it's actually very common. The process of the surgery is going to be performed by Dr. Day. We're going to prep your face and allow for the anesthetic to take effect, and the surgeon will then use a scalpel to remove all pieces of the cancer in the middle of your cheekbone. And then the surgeon's going to remove a thin layer of tissue underneath and around the cancer and where it was, and to make sure you don't damage any skin around it. And after removal, the surgeon will stitch together the fissure and where the lesion was removed, and there may be some erythema or like redness on or around the wound, but this is normal because you have very pale skin. And the procedures will only take about 10 to 15 minutes. Minimal discomfort after the procedure is to be expected and can include some bruising or swelling, but only for a short amount of time. If it continues, please contact us and let us know. To counteract any pain or swelling, use a cold compress and any sort of over-the-counter pain medication like Advil, Tylenol, and rest and keep your hands away from your face as much as possible and let that wound heal up. After the procedure, how are you feeling? Do you have any other questions or concerns before we schedule a follow-up appointment? We will see you again in 1 week to remove the sutures and to make sure everything is healing properly. Here's a card with the doctor's contact information and our number. If you have any questions or issues, don't hesitate to call. Have a good day.